I'm Oluwatosin Johnson. Today, I'll be presenting preventive care delivery, especially among the rural communities. By way of introduction, the focus of health service delivery is shifting from curative health to preventive health service. Preventive health service is a model of health service delivery involving a wide range of intervention from primary to secondary and tertiary intervention, and this aimed at reducing risk of threat to health. Preventive health service is cost effective than curative health in terms of resources. It's a long time investment and it addresses social determinants of health. Globally, we all know that health expenditure is increasingly becoming a financial burden. This is due to economic development, technological advancement, and the aging population. Chronic conditions such as hypertension, diabetes, stroke cause more morbidities and account for about 60% of the global mortalities. Previously, the emphasis was on curative health, but now the focus is shifting because there was no justifiable outcome. The prevalence of overweight and obesity resulting from unhealthy diets among children, adults, aged in the United States is unacceptably high. Looking at Kentucky, for instance, the Appalachian population in Kentucky are 1.5 times more than US poverty rate. About 7.1% of Kentucky rural residents lack health insurance and they are not able to attain good health. According to United States Department of Agriculture, the average per capita income for Kentucky residents in 2020 was $47,000, with the rural per capita at 39. With this, they cannot attain optimal health. Therefore, preventive health service delivery lowers these chronic conditions and lowers expenses on curative services. Preventive health service involves health promotion, health education, screening for potential illness, and rehabilitation to prevent disabilities, mobilities, complications, and mortalities. How do we attain this preventive health service? How could a community attain preventive health services? I'm going to be using SWOT analysis to address this and the role of advanced nurse practitioners to address it. SWOT analysis is the strengths, the weakness, and opportunities that the community has to address the issue of preventive health services. Some communities have a very strong social network and connections. They have strong family life, especially the rural communities. They have a strong bond and they are willing to help each other. So they could use these abilities, these strengths and opportunities they have to encourage each other to attain optimal health by encouraging each other to eat healthy diets, by going for periodical screening, which lowers the risk of chronic conditions. They can use their creativities and devotions to achieve these success. What are the roles of an advanced nurse practitioner? Contemporary health service system is a complex system and it requires leadership and a very strong innovations. Advanced nurse practitioners can function as mentors, innovators, agents of change, and voice to the voiceless. More often than not, the rural dwellers don't have a voice or they have no one to speak for them. But an advanced nurse practitioner can use this opportunity, the opportunity they have to speak for these voiceless ones. They can advocate for them by collaborating with the government to achieve a preventive health or attain a preventive health. This can be achievable through collaborative efforts, which involves advocacy, lobbying, consultation, and proposals to relevant governmental and non-governmental organizations. Preventive care service is crucial to maintaining optimal health. An advanced nurse practitioner therefore have professional duties to advocate for policies that prevent illness, promote health, alleviate suffering, rehabilitate the rural population in the states where they are practicing. The question I would like to ask us and I will discuss next time is what will be the focus of health service delivery in the next century? What will be the relevance of advanced practice nurses in the delivery of preventive health services in the nearest future? That will be the questions for our next presentation. Thank you so much. Thanks for listening.